In the morning, a nice, warm welcome for Dr. Bernard Marichal, who is from Belgium, who will talk about Immujem Therapy. Doctor, thank you.
Good morning. Welcome. I see that all the interested people are already here, so we can start. Before the start, I have some personal messages for some of you. First one is that I'm running after Laverne since 3 days, and now I know she's here, and I ask her to come because I have a special treat for her from Belgium. So if Laverne wants to come now, she's welcome. I finally see her. Since 3 days I'm looking for her. Because I brought you some special chocolates from Belgium for you. That's for you.
Thank you. Homeopathic?
No.
These are not homeopathic?
No, you can eat it, no problem,
okay.
No danger.
No danger.
I'm sorry, there are only 2 in it. One for Steve, one for Laverne, because I had to travel light.
We'll share.
That's what he's supposed to do. That's his duty.
Okay.
Yeah. I'll tell him.
Some other personal message I have for Andre. Andre, I got your coffee from Belgium for you. So you ask me after the conference, you get it. And 2 persons asked me some questions yesterday evening, and I asked for some reflection for the night to be able to give my answer. So for the first person, the answer is yes, and for the second one is no. Three gnomes were at the secular meeting of the gnomes. As you know, gnomes are meeting every century. And it's a meeting for 1 month. And I may talk to you about it because it finished yesterday, because it's completely secret. And in fact, I was their special guest, and 3 of them were discussing about the hate of their parents. And the first said, yeah, my father could walk under a table, no problem. And his hat, just the top of his hat was just under the table. And the second one say, oh, mine was smaller, because he could walk the same way but just under his chair. And the third one was starting to laugh and said, oh, you know, my father broke his 2 legs. He was on top of a ladder and he fell down when he was plucking the strawberries. Doctor, I've AIDS. What can you do for me? I've been doomed at the clinic. They say there's nothing to do for me, and they give me 3 months more. What can you do for me? That was 6 years ago, October '84. The patient came to us and said, what I told you now. We said, okay, you want to start something with us, let's try it. We made all the blood analysis to be sure he got positive, and it was a real AIDS, and it was a real AIDS. And that man started the treatment. He is still alive. And after 1 year, when he went back to the university clinic, the professor told him, sir, I'm sorry to tell you, but we made a mistake. It's not possible that you have AIDS because you're recovered, and we have made a mistake. Fortunately, we have the files to show it was not a mistake. That man is, as I told you, alive, working hard, and he just wants one thing, is that it continues in the same way, and to forget what all others told him. Now, I would like to invite you to a theater where you have some people playing a role, you have some decoration, and you have some programs saying what's happening before. The program started 23 years ago. by a lucky discovery of my father-in-law, Dr. Genard, that I joined when I met his daughter, is my wife now. And patient came to him and said, we have cancer and we are so tired and we're so completely exhausted. What can you do for us? And he said, okay, I try to give you just a little energetic jump. And he gave them some specialty called DNA and RNA. And he was amazed 2 or 3 months later because people came back and say, we feel much more better, but our specialists in cancer don't understand because the evolution of the cancer stopped. That was a special thing. He said, okay, now there is something behind that. Let's look what it is. And he looked at the literature and found some studies made on DNA and RNA saying that people were really doing better, but that it could provoke some epileptic fits. And since he is a homeopath, he said, okay, because it's so, let's dilute it and potency it and see what we can do with it. And he's done it, and the first patient to whom he gave it was an old man from 81, doing pretty well. He took his first powder of DNA in 7C and got 4 hours epileptic crisis non-stop with 1 powder. So the crisis stopped by a classical medication, and he got off the treatment for 3 weeks, and then he started by himself to take another powder, and he got an epileptic fit for 1 hour. So here we have the proof that even diluted, even taken orally, RNA and DNA are working and can give some effects that really, you can immediately see it. From there, my father-in-law, I was still a kid at that moment, I was still at university. From there, he started to study the immunology. And I joined him 10 years ago, and now I think we may say we are on the edge and looking for what every day is coming out in that field. It's really fantastic. And little by little we could add several products to the DNA and RNA in order to improve our cures, our treatment, in order to make it all the time better. And as you know, cancer is the result of a lowering of the immune system. So what we try to do is to enhance it, to improve it. And therefore, we based our treatment on 3 important facts. That we took out the homeopathy, and that is our only relationship to homeopathy. Because our treatment is not, as the classical homeopaths say, a homeopathic treatment, and you'll immediately discover why. We are using the principle of low doses. We are using the principle of similitude. And we are using the principle of, that's a hard word for me, individualization. Principle of low doses, why? Because it's non-toxic, proven since centuries, and the immunologic field at the moment discovered that some products, some immunologic hormones that we make are working at 10 minus 15 molar, which is for us over a 7 CH. So we're talking about the same things. That's one. The similitude principle is the following in homeopathy. A substance, a crude substance, that can provoke in certain people, healthy people, some toxic symptoms, can cure the same symptoms in people who are sick. And I'll give you an example of that we are using in our cure of AIDS. It's cyclosporine. Cyclosporine has a toxic effect on T4 cells. HIV has a main target that are the T4 cells, as you know. We said, okay, just take our similitude principle, make a low dose of it, or a high deconcentration, as you like, and apply it to the patients. And we saw the T4 count rising, and the T4-T8 ratio, which are the T4-T8 ratio of lymphocyte, rising too in AIDS patients. Now, you'll say that's your experience, and what say the classicals of that? Well, the classicals, maybe you remember, 7 years ago, two French people, Professor Yves and Andrieux from Paris, made a big press conference saying, we found the solution for AIDS, and the solution is cyclosporine. They made the conference very quickly, and they were helped by the Ministry of Health of France for that, in order to be the first. Problem is that they were lucky to do it, because 3 days after their press conference, all their treated patients by cyclosporine died. And it's easy to understand if you have a homeopathic way of thinking. You have AIDS patients, they are frail. Their immune system is dramatically lowered. And you give them a toxic, crude remedy. You first of all have an application of the similitude principle that makes that the patient are doing better. And it was the first step they saw. They were doing better, and they made a press conference. But still taking that, they were intoxicated. And since they were so frail, they died. Now, there is another category of patients that are even frail. The grafted patients. People who are grafted from a kidney, from a bone marrow, from a heart part, and so on. They have to take cyclosporine to avoid a rejection of their grafted organ. And they have no problem with the cyclosporine, and they don't die from it, because there is no similitude principle in that case. And so you see, we are using our similitude principle, but in our immune therapy we are using it only on a biological level and not on a whole person level. We just use the biological level. And the third principle is the principle of individualization, which means if you look at your left, at your right, and in your mirror, you see different people, because we are all different. And that difference is biologically easy to determine by our HLA system. And we got the idea several months ago to individualize the patient on that way and to start a treatment on that. And the first results in a disease that has, for me, a special affinity. Since 10 years I'm working on it, it's multiple sclerosis. And I hope Steve will invite me in the next 2 years. I can give you more information about it, because it looks very promising. So, did everybody read that? Okay. What is Immunjjem? That's in French, but you'll see it's easy French. I'll translate it immediately for you. It's a project of research called Immujem. Immujem is including all our studies on that immunologic field. And as you know, at the moment, the classical medicine is completely revising all its roots and discovering that over 90% of all the diseases are related to immunology, something to do with what we are doing in our research. And we find out of that a line of treatments that is called immunovanda. Immunovanda is a division of a laboratory in Belgium, which is called Vanda, and is actually at the moment producing different products. One for autoimmune disease, one for hepatitis, one for AIDS, one for cancer, and several others. So you see French is really easy when translated. Now, how could we do that? In fact, at the moment we tested out 200 different immunologic products. And they are all potencied, all prepared on the homeopathic way, as I told you. Non-toxic. We tried on ourselves. First rabbit is myself. And you see I'm still alive, so it's not really dangerous. But you have to be congruent, you know, if you give something to your patient, and if you really care about them, you may be sure that first of all you don't harm them. So if you want to try it, you try it on yourself first. So, what's SVA? SVA, as you know, we are French-speaking people, and we kept it simple for us. And the S is from SIDA, which is the French label from AIDS. VA is coming from Vanda. So SVA is the treatment we are using. The treatment is not including one remedy, but 8 of them. They are all in different dilutions that we determined by experience. They are seated in the box I show you immediately. Every capsule is different, and it's an evolutive cure, as we say. So we have a cure for 8 days, repeated 8 days, repeated 8 days, and so on. And several products in these are changing on each pattern, are changing their dilution. And that's the way we have an evolution in the treatment. So it's not all the day the same thing, every day the same thing, and it's not every day the same dilution. And that's what the body needs. Because what we are doing with SVA, in fact, it's easy. When the first patient came to us and said, I have AIDS, what can you do? Well, AIDS is a lowering of the immune disease, of the immune system. SVA, AIDS, cancer is the same thing. So we just tried our cancer treatments and added the cyclosporin. That's all at that moment. Now we are up to 8 remedies, and I have to take the box to know which one they are. I just forget all the time 1 or 2, because I'm playing around with all that every day, you know, and sometimes I'm mixing a little bit. So you have the RNA and DNA. RNA is, as you know, an inducer of interferon. We are using interleukin-1. Interleukin-1 is an immunologic hormone that's locally acting, very short possibility of acting, at the very beginning of our immune cascade when something is starting. I just show you in order you know what it is and what it means, but don't worry, I don't explain you all, because otherwise you need some aspirin. Here we are. So, keep it simple. You have an antibody here going through, an antigen, sorry, going through the bone marrow. No, sorry. You have an antigen entering a macrophage that digests it and presents it to the T4 cell. When that happens, the T4 cell is activated and is producing interleukin-2 that is going on all the target afterwards, but that's not my purpose. My purpose is in AIDS, that's the target of the virus. Because that's the target of the virus. If that is gone, the whole immune system has no reaction and is gone. So we are using interleukin-1, because interleukin-1 is already secreted by the macrophage in order to activate the T4 that get a receptor for interleukin-1. So it's the early beginning of the whole cascade. So what we are doing on that is help the body by a small dilution of interleukin-1 to stimulate this. Once it's stimulated, it proliferates by itself, and you have a multiplication of them. So we can have an enhancing of the T4 count by the interleukin-1. We are using other products too. We are using interleukin-3, which is another hormone that is a complete and general stimulating factor of all white blood cells. It's the strongest one we can find. It's stronger as the granulocyte macrophage colony stimulating factor, and is stronger as the granulocyte colony stimulating factor. So that's our technical terms, but it's to say that at the bone marrow, at the beginning of the thing, of the whole producing of the white blood cells, you already can have a stimulation. We are using other products as interferon. Maybe you've read about it in Kenya 2 or 3 months ago. A French doctor found a really amazing thing that if you give to AIDS patients by the mouth some units, about 5 or 10 of interferon, they improve. And that has been published. We are doing that since 6 years. Just the same thing, because we are using some units in our treatment. We are using hematopoietin in it. Hematopoietin is a substance which is a stimulating factor for the red blood cells. And as you know, most of the AIDS patients are anemic. And by that stimulation, they go better. Remember, we are using low doses. We are using potency remedies, so we have another information for the body as the crude substance. And all these substances, as I told you now, are enhancing the immune system. Now there is another one, which is called PAA, for in French polypeptide anti-ATP, anti-atypic polypeptide. If you take an immunoglobulin, an antibody, a human one, a G1, and you inject it to a rabbit, for that rabbit, that product is an antigen. So it will make some antibodies against it. You take off these antibodies, and what is amazing that the part of the structure of that antibody is similar to the antigen, the first one. So we have here a similarity once again. And we used it for cancer patients in order to help them to destroy their cancer cells. Fortunately, one of us made some cell cultures and made some viral cultures. And so that product at a specific dilution had antiviral properties, very broad one. And we used that just in order to knock down, if possible, a part of the virus that is outside the white blood cells, the HIV virus. So our treatment is working on 2 levels. The first one is trying to enhance the immune system. The second one is try to knock down the virus. So we have both in it. And I'm happy to say that maybe we are the only working on both sides at a time. So how is it looking like? Here you have a box. You can see it. You can have a look afterwards. In that box of Immujem, you have capsules, blistered capsules. The patient is taking 1 every day. He just has to open the blister, open the capsule, and put the powder which is inside under his tongue. Let it melt away. It has a sugar taste, not so bad. And that's all. If he has already AIDS, we ask that he's taking 2 a day. If he's only seropositive, only 1 a day. Why are we working so well? In fact, as soon as the patient got positive, his immune system is still okay. If we can keep him okay, we are on target. If we are later on in the evolution, his immune system already dropped, you find some problems with opportunistic disease, diarrheas, Kaposi, and so on. And you have to start from low and try to enhance it. First of all, stop the dropping and then enhance it. So it's double work. So as soon as we can start with the patient who is still healthy but seropositive, we start the treatment. We have now altogether in our little team over 450 patients treated. And I'll give you the results of a study that we have made by accident, in Africa. 3 years ago, a patient of my father-in-law came to him and said, okay, look, I'm a boss of a big private enterprise in Africa, and for us, for our employees, everything about health is completely paid by our society. So if we have to start to pay for classical medication in AIDS in 2 years, we just can't stop to work because there will be no more money. What can you do for us? And we had a meeting with the doctor of the company, and we said, okay, now our purpose is to help you. Take it, try it, and we have only one thing we ask you is, first of all, try it on the people who are the sickest. So take only stage 4, which means full-blown AIDS patients. 3 months later he came and said, okay, I have already 39 patients included in the program, and he said, what's amazing is in fact that 11 of them refused the diagnosis. They say, I'm sorry, this is a mistake, doctor. I have no AIDS, I'm no positive, it's not possible, so I refuse the treatment and anything. So we had a witness group of 11 patients versus 28 that took the remedy. That is not a double blind, I know, but our purpose was not to make a study, was to help people. As I tell you, we are practitioners, we are not people being able to say, you may have it, you get a placebo. We say, we try to help everybody. But we had that group, and so we made some determinations on them, and we asked the colleague there in Africa to look for what he could, because the situation is not so easy, looking for the bodily weight, for the frequency of diarrheas, more than 2 months lasting diarrheas, which is stronger as what the CDC criteria say, because they say only 1 month. For AIDS, we are looking for, he was looking for the frequency of fevers and of opportunistic diseases. All patients have been seen monthly. But if they had some problems in between, of course, they could come in between. The only criteria to enter that study was to be HIV positive by ELISA, confirmed by Western blot. And that patient were at stadium 3 or 4 of the CDC criteria for HIV. As I told you, weight of body, frequency of infectious episodes, diarrhea, and when possible, we took some blood samples to have the T4, the absolute T4 count, the percentage of T4 lymphocytes, of T8, and the ratio of T4, T8. Now, after that, we found that in our study we had 2 patients at stage 3 and 26 at stage 4. The untreated group, as I said, was 11, and the others was 28. Remedies, I've put them here. And after 1 year, we got the results. We draft them up. We sent a classical colleague to do that, so we were not suspect of doing wrong numbers. It's important for classical people. If you treat such an emotional subject, and if you are not doing that on a classical way. So we have to protect ourselves from being sure that they don't say you are lying. Yeah, I put it out and I show you on the slides. Can you put it on for the slides, please? Oh, marvelous. It works. Here are, sorry for all that numbers, but I think it's important to know that even in our field we can make statistics, and the statistics are bringing something out of them. Here are the witness group people, all at stage 4. Here you have the treated group, all at stage 4, except 2 of them at stage 3. What are the clinical results after 1 year? All these numbers are a mean frequency in percentage of total number of consultations. I have to explain you that quickly. Patients came every month, but if there is something in between they could come. So every patient had a different total number of consultations, so we had to take a percentage about it. For diarrhea, more than 12 months, in the witness group you have 37% consultation for that. In the treated group, only 6%, which means 6 times less. For the fever, you have 15% in the witness group and 8% in the treated group, more or less half of that. And for the opportunistic diseases, the infections, 54% of the consultations in the witness group were for that, and only 18 in the treated group, which means 3 times less. The weight. The mean loss of weight after 1 year of study was minus 22 kilograms. It's in kilograms, not in pounds, for the witness group, and the treated went 3 kilograms back. Now in Africa, that is the most important thing, because socially seen, AIDS is called their slim disease. And when somebody of your family there is going to slow down his weight, the etiquette that he has put on it immediately is slim disease. And people know that you can't cure of it, and you're rejected. Now, if you see there that they are no more going down but winning some weight back, the etiquette is removed and patients are reaccepted. Our colleague there told us that after 6 months treatment, economically seen, he could not make a difference between the people with AIDS and treated versus the healthy people, because going back at work was no difference. Dynamism at work was no difference, and people were as productive as the others. Here we are on T4, T8 ratio, and we took the beginning of the study, the value of the T8, T4, and we had the maximal relative enhancement of it. What's amazing, and that's statistics, but that's the truth, in the 2 groups there is an enhancing. Can happen. Witness group enhancing of 5% for the T4. Treated group enhancing from 50%. for T8 ratio, you go from 28 to 38. Now we just start in statistics. So people don't like it, just close your eyes, relax. It's just a bad moment to go through. That's an average and a standard deviation. It doesn't mean anything because our groups are small groups. And we had big problems with the statistics because we are working with small groups. And we need a specialist in statistics who is at the University of Louvain in Belgium that used the computer of the university in order to find how we could bring out some statistics. Because if you look at the numbers we had just before on the slides, you'll see there is a difference. But it doesn't mean anything in statistics. So what we've done is try to find a formula that we could use it. Just go quickly through it. That is to show you that diarrhea, fever, and infection are low correlated with each other. So we are measuring different things. You have a correlation of 0.44 between fever and diarrhea. Between diarrhea and infections is 0.20, and between infections and diarrhea is, fever it's 0.12. So it means that we have different criteria that we measured. We made a spread, and I don't enter in the statistics and how it was done. I just don't know because not my job. But we put on a surface the spread of the people, how they were, and I show you what it gives. It's that. Maybe you can lower a little bit the light. The people who are represented by C in red are the controls, the witness group. People by A are the treated. You have to know in that figure that people who are more on the right side of the slide are the people who have most of the three problems. These who are on the left are those who have of the less of the three problems. Somewhere must be a mistake, I suppose. Thank you. Okay, so you already can see that there is you can cut a line so in between, and you see that in fact treated group has more problems, the non-treated group versus the treated group. These little letters A with a circle around means that at that point you have 2 persons on it. And here is a point where there are 7 targeted here. So, means that, oh, let it be so, it's okay. It means if you look at this, and the classical colleagues may not say it's not true, but that statistics we could show that our treatment is giving something positive. Now, we took it after 2 years. The S disappeared in the plane when I came over. Diarrhea, 41. Treated group, 7. You find back the number of ratio 1 to 6. Fever stayed the same in percentage, 15 to 8. And infection came from 49 to 24, twice less. I remember you that are the sickest people we took for the study. After 2 years, the results are not so amazing as after 1 year, but are still good. 15 kilograms difference. Why have we some difference? It's because we included in our group all the patients, even though they died after 2 weeks of treatment. That statistics you have to be completely congruent or you have not to do it. And in the 2 groups, 4 people died. So 4 or 11, 4 to 28. And that's the reason why we have a difference in the weight here. Percentage enhancing of 5% in the witness group, enhancing for the T4 of 186. T4, T8 ratio, 28 to 34. Wow, it worked. Let's start in the beginning, please. Okay, we did not make any statistics on that for one simple reason. They have not the opportunity there in that country to measure the T4 and the T8 lymphocytes. So when our colleague came over to Belgium, he asked all his people to come to him in the morning. He drafted up the blood and brought it with him. Problem is, of course, that all the people are not at the same stage of treatment. So we can't make any statistics on that because it would be false. But the numbers on themselves are speaking by themselves for me. That's the formula that we use in SVA. As I told you, RNA, DNA, erythropoietin, interferon alpha, interleukin 1, 3, PAA, and cyclosporin. Dilution from 3 to 9 CH made by Immunovanda. Can I have the light, please? Now they put it out. They can put it on. And I just told you now about AIDS. And I know how emotional is that subject. I know how people are looking for something to do for them because their life is threatened. So please, if there are people of the press here, please don't make a sensational paper on it. And I'll be negative on that. I'll say, don't give false hope to people. That was the reason why we took so many years before speaking about it. We want to be sure of our results. We want to be sure of our statistics. We want to be sure that we could give any false hope to people. And I think that's very important. And again, it's not my habit to be negative, but we never said we found a remedy that cures AIDS. Never. I help people to be clinically well, go back to work for most of them. I say I can do in order that they can have a normal life. I never told that I cured AIDS, and it would be a big mistake. Why? Because at the moment there is no test in the world able to say that the virus lost the body. It doesn't exist. When you get the virus, you get seropositive for it. And normally seen, you get that seropositive forever. If you got measles when you were a child, you're still positive for measles now. The difference between measles and HIV is that the antibodies that make you positive, serologically seen, are acting and destroying measles agent. The big problem is that it's not the case for AIDS. Should it be, we will not be here to talk about it. So, people saying that they are negativing their patients with the treatment from positive to negative is a bad sign. Why? It means that the patient not has the possibility to build up memory cells in order to stay positive. That's important to know. So people say your treatment is not negative, because it would be a big mistake somewhere. So that's about AIDS. Now that's only a small part of what we can do with Immujem Therapy. And I promised Steve to be on the time and not to be too late and not to bother you too much with all that. But it's important to know that the small part, which is the most emotional part, if we look at the rest, it's much more larger. I told you 90% of the diseases are related to the immunologic system. Now, I spoke to you about cancer, I spoke to you about autoimmune diseases, I spoke to you about other viral diseases, EBV, Epstein-Barr virus, which is a part of the chronic fatigue syndrome, as you know, the CMV, cytomegalovirus, hepatitis, chronic or acute. And the results we have with hepatitis are much more beautiful as these. Because an acute hepatitis, and even the classical homeopaths know it, if you are on target, in 1 week you're off it. You have not the time to be yellow. And that's not a joke. really, you may ask the homeopath here in the room, they tell the same as me, if you are on target. So now I don't ask all my colleagues to study that long philosophy and long study for homeopathy, because we can do it simpler, and we have good results too with the HIV that we have for that. It works very well. Now, I had 2 kids coming to me with a disease of Duchenne, which is a disease that is a genetic one. These kids are producing genetically a bad protein, and their muscles are really not more working little by little. And first of all, they can't stand up, they can't walk, and they're dying, completely choking, because their muscles off between the, forgot it, the ribs, thank you. Thank you, spare rib, that's right. And these kids are dying, and I had twins coming to me and said, what can you do for them? In fact, that protein is not recognized by the body as being a self-protein. So the body is reacting against it. And we have a form of autoimmune disease, and I tried that treatment. Now, when the twins are coming to me, they are invited to enter my practice, one and after each other. Because if they come together, I'm exhausted, and my practice is destroyed. It's impossible to keep them sitting for 2 seconds. When they came, they could walk for 10 meters, and it was off. They had to sit. And now it's 4 years I have that people. I have several others, but that are my oldest. And all of them are doing well. So you see, even so far as this kind of disease, we already can help, even if we have not the solution. But with that, we can bring our patients in good shape up to when the final solution will be found. And if I can bring you in good shape up to there, I got my target. And I'm happy for it. So now, we are working on another branch, and I just develop you as an appetizer for next time, maybe. If Steve is not too tired to see me. And that is the fact that working through the HLA system, you can individualize the patient. And as you know, the HLA system is determined only now at the moment for people knowing that they need a graft, and you have to be as similar as possible between the grafted one and the donor. Now I put a treatment that I will not develop here based on that determination. And the results I've seen coming back, as I told you in the beginning, are really amazing. In AIDS, Crohn's disease, rectocolitis, polyarthritis, and so on, as you see, all that kind of heavy diseases that are related to the HLA system, which means that we can make a real personalized treatment for everybody using specific remedies prepared on the same way and giving results with non-toxic things for diseases where we have nothing to do than maybe to help. And I give you an example of it, and I know it's like a bomb, but I have to tell it. Diabetes is related to HLA DR3 and 4. It's known. If I can start a treatment in a brand new beginning diabetes patient, in 2 months is over it. Now, there is better, because that's only curative. If I find somebody being HLA DR3 and 4, I already can give him a cure in order that he will not develop maybe later a diabetes. So with that kind of therapy, I'm doing on preventive medicine. Preventive medicine is my goal, because you have not to cure, you can prevent. Stupid to say, but for the patient it's better, for the doctor it's better, and for the insurance company it's better too. And as you see, I'm not out of ideas. I have no money for doing that. I don't need it. I don't ask you it. And maybe it's important to know that if you have no money, or less, or a little bit, you are obliged to use it on a good way. And for using it a good way, you have to use your brain. And I think that is important to know, that we have so many things inside of us. And it's only when we are obliged to try to get them out that we can have it. And all the discoveries we made, we found it by joke. Playing around with materials when we were on vacation, when we were on holidays. And all what we found here, what I told you about, has been found by playing, by making fun. And I think it's important that all of you get out of here, and every day, that's my last message, try to laugh half an hour. You will feel much more better. So, for those who are interested in it, for those who are still awake, for those who are free of headache and so on at the moment, there are papers that I gave to Steve Ross that you can ask him in 1 week. Just let him recover of the conference, please. And there were other papers I gave him 2 years ago. Forget them now. I proved with the new ones. So ask for the new package. He knows what it is. You can have a look on this. It's not necessary to steal it, because it's only to show you. And inside you see capsules with powder. There is no product on the powder, just a placebo. So somebody who would be interested to take it can take it, but it has no effect. It's important to know. And the last thing, if people are interested in order some remedies from Vanda, Steve Ross has some, can send you from next week, if you ask him, the order forms. And you can ask him to that, and everything is written down on it, how to do that. So, I think, yeah, it's 10:02. Sorry, I'm 2 minutes too late. And I let you free now. Thank you for your attention.
Thank you, Doctor. To each of our speakers, we're presenting a commemorative plaque from the World Research Foundation, commemorative of their speaking today, and we want to thank you, Doctor, and we wonder when your joke book's coming out. But hey, let's give Dr. Marichal a big round of applause. Thank you very much.
Thank you.